Okay, Grace, so this is going to be our video on MCI, or mild cognitive impairment. So we're just going to go through this paper here, put out by myclevelandclinic.org. So this is a health clinic in Cleveland.
Okay.
And it's about mild cognitive impairment. Mild cognitive impairment, or MCI, happens when you have a slight decline in your mental abilities like memory and completing complex tasks. We know this is a normal part of the aging process, okay?
Yes.
And there are several possible causes, some of which are treatable, which we also agree and we think we've done for you, right?
Good proof.
Good proof, yes. A healthcare provider can evaluate for your diagnosis and possible treatment. So I design your treatment plan, and then the doctors help us, right? We don't want any names anyway now, but the doctors help us, right?
Yes,
Some of them did, right?
course.
And then down here, what is mild cognitive impairment? It happens when you experience a slight but noticeable decline in mental abilities compared to others your age. But you don't have any problem compared to others your age, really. Only your memory, see? Mental abilities include memory, so you have a problem with your memory. But if somebody lets you focus and ask all the questions you want to ask, your reasoning and judgment skills are great, aren't they?
Pretty good. I'm happy.
Okay, you have to speak up, though.
I'm happy and pleased with myself.
Haha, you should be.
It's important to
And
yourself.
Even your memory, we videotaped this morning, you remembered everything that happened yesterday, didn't you?
Yes, I did.
Yes, you did. And so then your planning and completing complex tasks is even getting better, I think.
Enjoy them.
Your ability to pay your bills and stuff. Speaking of which, you have to go pay your hydro bill today. So you may notice the decline in your abilities or a loved one, but the changes aren't severe enough to interfere with daily routine and activities of life. But because of your memory, somebody like you can forget to take your pills and stuff, right? So what is the difference between mild cognitive impairment and mental decline due to aging?
Very interesting question.
It's natural and expected to have some gradual mental decline as you age.
Oh, I see.
For
Okay.
example, learning new information may take longer than before, or your speed of performance may get slower. Right? So we just slow down a little bit, like you said yesterday. There's so much information. It's not like being a young person. You have a small library, right?
Yes.
But these declines due to aging don't affect your overall functioning or ability to perform daily activities. Normal aging doesn't affect recognition, intelligence, or long-term memory. So normal aging will affect your short-term but not your long-term, right? And it doesn't affect your recognition, and you recognize pretty much everybody pretty quickly, and your intelligence is, superior. So then it says, as you age beyond 65 years, you may occasionally forget names and words and misplace things. With mild cognitive impairment, you frequently forget conversations and information that you would typically remember, like appointments and other planned events. MCI interferes with your daily routine activities. So, I think you're getting better with your daytimer and everything with your appointments now, right?
Yes, improved.
You're getting much better, right? And you're able to plan things better, right?
I remember them.
And yesterday you remembered all your conversations. Better than me yesterday. You remembered everything yesterday, basically. Like, you really are getting quite a bit better, right? We already videotaped it, I already put it online. MCI interferes with your daily routine activities. So, in your case, before, you couldn't have appointments, right, by yourself. You couldn't even remember to take your pills and everything on time, or how to and your insulin was very difficult, right?
Right. Challenging. You help me a lot.
So
Thank you.
we try to make it easy, and we're getting it to be very simplified for you now, because we would like you to be able to live your best life, right? With the least amount of interference, but some assisted living to make sure everything is okay, and to have a friend in the neighborhood that comes in and helps you with your meals and your diet and all of that, because you need help with that, Grace, and that's
Definitely.
absolutely fine. And what's the difference between dementia and mild cognitive impairment?
Would you please help me?
Both dementia and mild cognitive impairment are descriptive terms that tell us about the degree of cognitive change and how it affects daily activities. The main difference between MCI and dementia is the mental decline in mild cognitive impairment doesn't interfere with daily living, whereas dementia does.
I see.
Right? In addition, people with MCI, mild cognitive impairment, don't experience personality changes that people with dementia can. Many underlying conditions can lead to mild cognitive impairment or dementia. So, as long as you have somebody to help you with your medication and the plan we've been on and everything, look what we did, right? We're changing some of this, and we believe all of this, actually, basically. And then it says, dementia involves a decline in mental function from a previously higher level that's severe enough to interfere with daily living. A person with dementia has two or more of these specific difficulties, including a decline in memory. But your memory is getting better, right?
Yes.
You have to speak up, Grace.
Yes. It's more organized.
Yeah, it's better, right?
Yes.
A month ago or a month and a half ago, you said you were getting worse, remember? And I said that's because you're not taking the drops. So you went back to taking the drops, and now you're better again. And there's 2 different drops I give you. And when I give you the second one, you got even better. But it was about 3 or 4 weeks later, because they're expensive to get, Grace. A little bit. Not really. Comparatively speaking, no. And they're natural plants. So your memory's pretty good now. Like we said, you remembered everything from yesterday. How about your reasoning?
Pretty good. Of course, I need to remember all the factors, relevant factors, before I can analyze.
Yes. So that's why you need time to process in your own way,
Yes.
right?
That's the difference between the super people.
Yeah, well, that's okay. So that means you need to have the right to ask a lot of questions, and you need the people to have a lot of patience, right?
You are getting used to help me in the way I need.
Well, we don't want to create stress and create problems, because we'll find out soon that the anxiety and the stress are what caused the problem. So we have to minimize that. But your reasoning skills are exemplary, even with regards to the fact that you found me in the beginning and you've been following the plan, and recently you discovered that you were getting worse on your own and volunteered to start taking the drops again, right?
Yes, thank you.
Right, so your reasoning is very, very good, Grace. You got out of the hospital on your own with your help from one doctor, right? So, your reasoning is excellent. And I could go on, even you went to the bank to try to get some help, to borrow some, anyway, and they give you a hard time, even though your reasoning skills and your planning and everything is superb. And you go there several times. Anyway, that's a different story, but your reasoning is exemplary. How about your language?
A bit slower, but still very good.
You're pretty sharp.
Thank you.
You can chop me down. Can you chop me down?
Well, because you make the, yes, I do. I enjoy it because you're very clear in your information to me.
Very good, Grace.
I'm happy that you bring out the impact. Good conversation is not one-sided, it's two-sided.
Yes. And your coordination? So when I met you, you had a cane, right?
Yes.
And now you walk on the treadmill, you walk in fields, you walk everywhere all the time, no cane.
As a young lady.
As a young lady, yeah, you do. You do. You walk 7 kilometers with me. You've walked more than that. I know, it's amazing. And so your coordination's improved, your memory's improved, your language and reasoning, I would say, are very similar, except with your memory improving, it gives you a little bit of reasoning. And your coordination improved. And your mood, how about your mood?
Very good. Because my coordination skill has improved so much, I would have no difficulty in coordinating my clothing, which is and color and all that. I still always look fashionable and
But I'm talking,
good.
yes, you do. But I'm talking right now. That was physical coordination, Grace.
No, it requires the mind too.
That's a different type of coordination. I 100% agree. And you're right. Your coordination with clothes is exemplary.
I have to remember them all.
You're very good at that. But I'm talking about your coordination physically. So you got rid of the cane. They even had a walker a little while ago. But you go to walking to lots of social events all summer long, right?
This continue for long.
Yeah, because now they're finished because summer's over. But during the summer, we went to quite a few music festivals, didn't we?
Yes, very enjoyable.
Yeah, we went to the beach. We went for Walk with Israel, right? We had our 75th anniversary. So we've done a lot of things. That was about a 7-kilometer walk for you that day.
It's challenging for some people.
Yeah, for me. And you're on the treadmill?
Yes.
Right?
On the treadmill. Of course, with your supervision, you try to be safe. Make sure I don't do the wrong thing.
Well, right now still, but I think even after the summer we went back, you seem to be doing much better on your own.
Yes.
And your mood is much more positive.
Yes. With all this coordination of activities.
Well, you know what? Those activities involve physicality, right? Physical exercise, cardiovascular exercise, coordination of your body.
Yes.
That's why you don't need help with bathing and showers and everything, because you're fully mobile, right?
Yes.
And that also gets you out for social interaction, and which gives you hope molecules and improves your mood. Most people don't even know about hope molecules. They're not even mentioned here, but they exist and people know. They can look them up. And your behavior is very good.
May I add?
You worked a little too hard for me, but anyway.
One example of my strong coordination skill. I have, since I am a working person for a long time, of course my wardrobe will be so full of varieties. I have no difficulty in coordinating my clothing and my appearance in terms of the clothing, jewelry, and all that. I'm famous among my social circle.
That's your favorite thing from her lifetime. The old memories are not damaged at all. Not at all. The old memories are beautiful memories, Grace, and it does carry into your current day life. That's correct. You are known as, some people say when you go on the treadmill, it's like going on the fashion walkway, right? Like a model. So let's carry on here. So, does MCI, mild cognitive impairment, always lead to dementia? Some people eventually develop dementia, but others don't. For certain conditions, neurodegenerative, so if you have a problem in your brain degenerating, which you don't, maybe you did at one point due to the vascular or the vascular dementia, but they measured your brain with the CT scan a month and a half ago, and it was the same as when they checked it in 2018. So you don't have a neurodegenerative condition, okay?
Good.
These affect your brain, and your brain gets worse over time, but you don't have that. And we already show, if they look at one of our other movies about Grace's medical results, right? They'll see it. But some of those are Alzheimer's disease and Parkinson's disease. You don't have those. Some people with mild cognitive impairment return to normal cognition for their age or remain stable. You're one of those. And because you started out very brilliant, a fraud examiner, for example, your level is still like amazing, a very amazing, Grace. So some people return to normal cognition for their age or remain stable, right? Very important to know. And this is from the Cleveland Clinic. This is from Health. Here we go. How common is mild cognitive impairment? So from 65 to 69, it's 8%. From 75 to 79, which is you, it's 15%. And then from 80 to 84, it's 25%. Maybe your friend's sister's in there somewhere. And then 37% of people 85 or older. So the mild cognitive impairment, you can still bathe yourself. You can still go to the grocery store with a list. You still make your list. You can still dress yourself. Still feed yourself.
In a fashionable style.
In a fashionable style, yes. So it's quite common, and this is another reason why people should know what we're teaching them and helping them with,
Yes.
because they may have a parent to look after, to help, or they themselves may be alone and going down this path, or living with a family and going down this path, and they want to prevent it themselves, right?
Yes, I heard a lot of those type of challenging stories from friends.
So here's the symptoms and causes. Excuse me. These are the symptoms and causes.
Okay.
So the main sign of mild cognitive impairment is a slight decline in mental abilities. Examples include memory loss. You may forget recent events or repeat the same questions and stories.
Yes.
You may occasionally forget the names of friends and family members or forget appointments or planned events. You may also misplace items. So this is mild cognitive impairment, right?
Yes.
More often than usual, because everybody does that sometimes. But you don't, so that's kind of you there, right? You do that, but you're getting better at it. And then language issues. You have difficulty coming up with the right words. You may also have trouble understanding written or verbal information as well as you, but you don't really have trouble, but it takes you longer, right? Not like when you were young, but you're pretty good, right?
Pretty good, yes.
You're reading complex documents now. And attention, you may lose focus or get distracted more easily than you used to. But you always probably got distracted because your brain is very fast.
That's true. I've been told.
You've been told, right? And your ability to focus, look at what we're doing here. This is very good. And reasoning and judgment, you may have difficulty problem solving and making. Do you have difficulty making decisions or problem solving?
Takes longer because not necessarily in the bad prospect. Because when I look at when I was younger, when I look at an issue, I may look at 10 factors. But when I now, due to maturity and more knowledgeable in life, I may be looking similar issue, but I may be looking at more, expand my factors, the factors of concern.
Yeah, wow.
That's why it's not a reflection of my inability. It's just the complexity of the issues due to age.
Yes, and here's the next one, speaking of that, which we've been talking about lately, is complex planning, which is what you just talked about.
Yes.
And it says it may be more difficult to plan and or complete complex tasks like paying bills, taking medications, shopping, cooking, household cleaning, and driving. So basically on this list here, to have mild cognitive impairment, you have some memory problem, right? Which makes it difficult for you to pay your bills even though you're getting better at it. It makes it almost impossible for you to take your medications properly. It makes it 100% impossible for you to know what to buy and cook, okay? You cannot learn how to do your diet and count your calories. You're doing really, 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 really like amazing, and maybe you will, but I don't know if I can promise that yet. That's really complex, right? That's why I'm trying to make it habits where you eat certain meals, or if I prepared some meals for the week and brought them over, right?
You already in this respect. That's how helped me to improve myself in a more speedy way.
So this is all stuff that you need help with right here, and the driving even. The cleaning you still do very well, so I wouldn't worry about that at all. And I like you to do as much as possible. I think it's all important, right? And then
I want to have a partner working with me.
Well,
cleaning.
Yeah, well, maybe once in a while you could hire somebody to come and do a deep clean.
No, not somebody to do it for me. I like to have somebody work together, like a team.
Oh yeah, I don't know how to get to do that with you. But anyway, so and then there's also movement difficulties. But you don't have any. Before you couldn't move around, but now what did you say the other day? You run.
Yes, I'm much better now.
Yeah, you're much, much better now. And we use the finger method. We use healthy lifestyle, basically, is what we use, right?
Yes. The finger is very good.
Yeah, right. That's diet, exercise, cognitive challenge, socialization, and keeping a check on your heart. Because anytime you change your diet and exercise program, you should keep an eye on your heart, right? And we're working with the cardiovascular system under these conditions. So here it is. What causes mild cognitive impairment? And remember, you're getting better, right?
Yes.
So mild cognitive impairment can have several possible causes. Some are treatable and others aren't. Right? So some can treat, some can't. Some of the possible causes include, so if it's not your brain slowly deteriorating, right? Then the number one, look at this, depression, chronic stress, anxiety, sleep disorders. Those are the top 4 things that cause it, right?
Yes.
And the other one that may be equal to them is diabetes causes it, right? Too much sugar over a lifetime causes it.
That's your specialty. Your specialty.
Diabetes type 3. Yeah, it's dementia. Dementia is now called diabetes type 3. But all of this stuff here, a lot of that comes from the family being unable to really accept what's going on. It's a very difficult time for everybody, Grace.
Yes.
Even you're talking about your friend with the family, 6 doctors, they have a hard time with the one sister, right?
Because her condition deteriorates much faster, so the family member have to learn to cope with the changes.
They don't know how to help her, really. And now she's becoming argumentative and forgetting and blaming them for taking her stuff, right?
Yes.
And they're doctors. So, but we know how to help it. Look at how you're doing. So, but chronic stress and anxiety. So the fact that home care never helped us, they actually hurt us every step of the way. And then sleep disorders and the diabetes, okay? Or another thing to be very aware of is a vitamin B deficiency. So always take a good multivitamin. Or a urinary tract infection. I never knew that. It's very important to check. So when you have your test, they do though. That's really, really good. And then using drugs, right? Yes. And then so those ones, and then those ones are all curable. The stress and everything is curable. But sometimes mild cognitive impairment is an early stage of certain neurodegenerative conditions. That means your brain is starting to atrophy, right? Starting to break down. It can be an early stage of Alzheimer's or Parkinson's or Lewy body or vascular. But vascular dementia, we now know, you and I do, that it doesn't have to be a neurodegenerative condition. We're not the only ones that know it. That's why when you went on your keto-friendly diet, you got so thin so you could clean all of that out. Plus, we give you vasodilators, natural ones, so you can get better blood flow. Plus, the doctor helped you with some pills to give you lower blood pressure. So it's really, really good, right? So in this case, we're fixing this one too. We have fixed it already, basically. And then, what are the risk factors for mild cognitive impairment? Over 65, family history, cardiovascular disease, high blood pressure, which you don't, diabetes, obesity, cholesterol levels. So we've gotten rid of your obesity, we've controlled your diabetes. With the help of your doctor, we're controlling your cardiovascular disease, and I'm controlling mine completely, right? Am I controlling my cardiovascular disease? Remember they wanted to do triple heart bypass surgery?
Compared with those old days.
No, they wanted to do triple heart bypass surgery last year, but I don't need it because I take the same plants you do.
Oh, okay.
Right? So these are the things that contribute to it. And we controlled them. So, and we also controlled, we controlled some that they didn't think you could fix and some that they thought you could fix, and we controlled them all, right? And then here, how's it diagnosed? It may be difficult. Some of the symptoms are common to many other illnesses. Your healthcare will ask about your symptoms, your medical history, review your current medications. You actually had a note from the doctors from the hospital saying that you were taking too many pills at one point, right?
Yes.
So we reduced all of those, right? Or a lot of them, right? Gradually, year and a half or whatever, well, we just reduced them at metformin, and we're going to soon start to get you off the remaining insulin, I think. And ask about your history, perform a physical exam and mental status, get input from a family member or trusted friend on how your mental functions may have changed. So they should ask me, right? Because I'm with you every day, right?
Yes.
Nobody knows better than me.
And you're observant.
And then there's other tests, laboratory tests, right?
Yes.
And MRIs, looking for evidence of brain damage, but you have no problem in your brain because you just had a brain scan a month and a half ago. And your brain is the same as 2018.
Thanks, God.
Thank you, Lord. And your heart's the same as 2015. And your cholesterol's right in the middle. Everything is perfect, Grace. So your diet is really, really, really good. So, the treatment for mild cognitive impairment depends on the underlying cause if known. However, some cases of mild cognitive impairment from neurodegenerative diseases can't be reversed. But if your mental changes are due to causes like the urinary tract infection or sleep problems, which we fixed your sleep problems too, right? Mood, or medication side effects, which all of those pertain to you, don't they?
Yeah, well, yes. May I have a pen, please?
I don't have a pen here right now, Grace.
That's
Sorry.
Okay. All right.
What would you like
No,
to
it's
what would you like to do?
It's okay. Just try to stop dropping the notes.
So the sleep problems, right? You had, and your mood, and your medication side effects, right? All of them we fix, right?
Yes.
And then your healthcare provider, which is me, will come up with a treatment plan. And I did come up with a treatment plan called Healthy Lifestyle, right?
Yes, thank you.
And that's what we followed. And then we found later on the finger method was
Oh yes, help me a
was
lot.
close, right?
Yes.
But I had my own, the healthy lifestyle, which involved all that plus more. And that's what's going to be in our book and our course. So some can be fixed, right? So if it's just because you're unhappy, you're not sleeping, you're stressed, all that can be fixed, right?
That's right.
And then prevention. Can they prevent mild cognitive impairment? Not all cases are preventable, but here are steps you can take to try to keep your brain healthy and reduce your risk. No smoking, no drinking alcohol. Eat a healthy and balanced diet, which you work on every day, right? Exercise regularly, which you work on every day. Keep your blood pressure, cholesterol levels, and blood sugar levels under control, which we do every day.
So far so good.
Everything in this book is exactly almost about what we do, right?
That's right. It's a good leading information.
Yeah. And then minimizing and managing stress, right? All stuff we do, right? Everything I help you with. Getting quality sleep.
Oh yes.
So sometimes when you're laid up and stuff, and I give you the special drops for sleeping, right?
Yes, but fortunately not too often.
No, not too often. Very rarely. Very rarely, Grace. You know what? It only happens after you get a bad phone call or something and you get mixed up for a few days. But then you pick yourself up by your bootstraps and you take on that world again. You're absolutely one of the most amazing people I've ever met. And then exercising your brain by doing puzzles or reading, which you do a lot of reading now. Technical information you're starting to read.
And also lots of walking.
And lots of walking, yeah. And learning new skills. So this is a new skill for us that we're working on here, right? And engaging in social activities. We go to lots of activities. You go shopping by yourself. You interact everywhere you go, right?
Yes.
That's why you cannot go to a nursing home. You spread too many smiles in the community, Grace.
I'm enjoying myself too.
Yeah, and you enjoy yourself too. That's right. Very good. And seeing your healthcare provider regularly to manage any chronic conditions you have. So that's been me to a great extent, helping you manage your diabetes and everything, right?
Yes.
And then the prognosis. What's the outlook? The prognosis for mild cognitive decline varies based on the cause and other factors. Studies show, this is really good news here, that about 15% of people with mild cognitive impairment older than 65 years of age develop dementia within 2 years. Okay? But that's only 15%. That's a very low number. That's like 1 in 5.5 or 5.5 in 100 or something. They also show that 14, the same at the low end, to 38% return to their normal cognition level. Return to your normal cognition level, Grace. Do you understand?
Yes.
38% return, up to.
Oh.
14 to 38% return to their normal level. Only 15% get worse. Did you hear me? Only
Yes.
15% get worse. 14 to 38. We're almost finished. I know your eyes are sore. 14 to 38% of people return to their normal cognition level. The rate of decline in someone with mild cognitive impairment often depends on the underlying cause. So the underlying cause, if it's stress and anxiety and not sleeping and diabetes, these are all things that can be addressed through healthy lifestyle changes, which is going to be in the book and the course, right?
Yes.
How do I take care of myself? You may want to talk to your healthcare provider and anyone you trust with your future. Especially important if you think your MCI is an early stage of a neurodegenerative condition. But you do not have a neurodegenerative condition because you have a brain scan. The brain scan alone shows that you do not have dementia. Nobody can diagnose you with dementia when you have a brain scan that shows it hasn't gotten any worse in the last 5 years. Okay? You do not have dementia. You do not have early stage neurodegenerative condition because it hasn't degenerated any since 2018, okay? No change. These discussions are important because they can help ensure caregivers can honor your wishes if you can't choose for yourself in the future.
Yes.
So you want, I know, to stay in your condo as long as you can. And you asked me to do that for you, and you also asked me to help you reduce your medications, right?
Yes.
You asked me to help you with your diabetes care, right?
Right.
Speak up, Grace.
Yes.
And you asked me to help you with your home care.
Yes, of course.
So you would like to, and you want to stay in your condo. And I get it, right? So you should put your wishes and decisions in writing, preparing documents connected to legal issues and what happens if you can't care for yourself or make decisions for your care or well-being.
Okay. Thank you for the advice.
See, it's right here. And that's what you did when you gave me power of attorney for personal care, right? But I'm not really sure how legal that is. And because I think somebody else is controlling your stuff, right? You think so too. So when should you see your healthcare provider? Should see them every 6 to 12 months, depend on your treatment plan, help track changes in memory, thinking skills over time, and suggest changes that are relevant to your health. Keeping a personal record of any changes can also be helpful. So you've been getting better.
Yes, I am.
And then, if you've been diagnosed with mild cognitive impairment, it might be helpful to ask what caused it. We know stress and everything for you and diabetes. What management options do you have? So you chose to choose your own caregiver, your own person to help you, right? Which you're entitled to. And your family doctor is your specialist other than me, and actually the endocrinologist has been very helpful too. Will you develop dementia? Now you know because you read this, right? How can I keep my brain healthy? You and I have been doing that for the last almost 2 years. A note from the Cleveland Clinic. Learning that you have mild cognitive impairment can be overwhelming. You may have a lot of concerns and questions about what to expect. MCI, or mild cognitive impairment, affects everyone differently. Know that your healthcare provider will develop a plan that's unique to your situation. They'll be there to answer your questions and support you. So your healthcare provider is actually the one in conjunction with your power of attorney for personal care. Personal care only works if they have the power of attorney over your property as well. Otherwise, it can become conflict, and the person trying to look after your health can't help you. But so they're supposed to provide a plan, which you've asked home care for a plan every time they come here. You've asked them in an email. Your doctor has asked them for a plan. You never denied any services at all. Am I right?
Yes, you're right. I told them what my challenges I have. After they have very strict time schedule, because sometimes my body does not necessarily follow.
Yes.
That's
Well,
the challenges I felt I deal with when everything is so rigidly planned, but my body does not respond to it at the right time.
nobody responds like that, Grace. And you have to plan your meals, for example, for healthy living and your daily calorie. Let's
Yes.
call it your caloric consumption because you have to start with that,
Yes.
right? People don't talk about that so much anymore. But when you're trying to help with diabetes and trying to help with the vascular dementia and everything, you have to know the amount of calories you need per day per activity for the next 4 hours. And then you have to design your meal to burn appropriately for the activity level you're going to have, right? And also your mood.
Oh, yes, definitely. Very relevant.
You shouldn't be taking insulin when it's your mood that's elevating your glucose because the glucose from a mood will disappear quickly if the mood disappears quickly. And the insulin will then cause you to crash and you'll have to eat and eat and eat, right? But if the high glucose level is caused because you ate a plate of spaghetti or pasta or bread and all that, then the insulin can be effective. But even then, it's just turning it into fat anyway, getting it out of your cardiovascular system, but just turning it into fat basically. So, yeah, it's very, very important to plan your meals and be able to change your meal plan anytime depending on the upcoming activity level. Complex. You will probably always need help with that. You will probably always need somebody living nearby to come in to see you 4, 5, 6 times a day, help you with
Whenever I need help, which is very frequent.
help you with your groceries, dropping in, hey Grace, how you doing? Give you a hug. Same person every day, right? Sometimes you see them downstairs in the grocery store, even when they're not with you, or in the pharmacy, or in the mall, or out walking in the neighborhood, and they become a friend to you. That's the plan, right?
Yes.
And then they help you to decide, and they also take you for your exercise, and
And
they
you
take
do.
you to your appointments and things like that. Ideally, somebody living in the building could look after 2 people like you. And then with the money supplied by home care, the 2 people paying the 1 person, and then especially if they want a few extras like to be driven around to beaches and everything, then they have to pay more a little bit. And they also, before they pay more, after they get from home care, then they can go to their benefits. So somebody like you has really, really excellent benefits. So after home care pays some, then your benefits will top it up. And then if you top up a little bit further, you can have personal care for yourself. And it doesn't cost you that much, but it does cost you a significant amount. But because you saved your whole life and everything, you would be able to have the best care and you would be able to stay in your condo for the rest of your life with the right financial planning. Don't you think so?
Yes. Yeah, I thought you still have. Your discussion is very comprehensive, so I thought maybe you have more points to cover. That's why I did not interrupt.
But that's what you asked for, right? You wanted to stay
Yes.
in your condo, right?
Of course.
And when I see the view of your condo window, I totally understand it. And I also love my freedom.
And the conveniences.
But I mean, that's why you love your freedom too. That's why you want to
Yes,
stay
of
in your
course.
condo,
Yes.
right? You want to be in control of your medications. You want to be in control of what you eat, your healthy lifestyle that you choose, right?
I'm glad you used that terminology, inclusive of all the factors
Mm-hmm.
about my living.
Mm-hmm. To have a healthier, happier life, right?
Yes.
Let me do that a little bit better so we can see how beautiful your row fit looks, okay?
Thank you.
Yeah.
This is hand painted.
Yes.
Really.
Very nice. I've seen you
Hand
clean it
painted.
with some special little wipes or something, yeah.
Not by water.
No, not by water. I know that. I know that. Well, Grace, that was a pretty good conversation.
Thank you.
And we went over the mild cognitive impairment paper from the Cleveland Clinic. I suggest anybody that watches our video go and look that up themselves and read it themselves. I was going to add another little video in here on some Diabetes Canada information I found, but it might, this video is already 45 minutes long. So I think I'm going to make a separate video. We'll do it right now.
Good idea.
If that's okay with you.
Good idea.
Good idea. Look at you. Are you paying attention?
Yes.
Do you remember mostly what we talked about?
Well, I won't say almost, not 100%. Most.
But you
yes.
understand the mild cognitive impairment, the memory and stuff like that, right?
Of course, you have been looking after me so fully. I fully, every day. And I appreciate the help. I'm getting better than when we first started.
Yeah. And you're understanding that the causes for you are things that we can fix, right?
Yes.
We already fixed a lot of them.
I hope more people can share the benefits like I have.
Yes, me too, Grace. Me too. So hopefully they buy our book. Hopefully we set up our GoFundMe page and people will help us out because we're not getting any help at all. This has been almost a 2-year
more and more people
business startup. So people make a donation to our GoFundMe page. Maybe I can send them a bottle of our drops, at least within Canada. Anyway, Grace, I'm going to let everybody go. Wish them a very, very, very excellent day.
Okay.
And thank you for everything.
I hope everybody enjoyed all the benefits as I did.